right, joining us live now is Dr. Isaac Bogoch, Infectious Disease Specialist at Toronto General Hospital. Good morning, Dr. Bogoch. Good to see you again on this Thursday. All right, so let's get into it. A slight increase in hospitalizations yesterday. ICU admissions are leveling off. How are hospitals dealing with the strain, and what is the short-term prognosis?
Short-term things look good. We have seen a significant trend of downward and decompressing of the hospitals and, of course, including the ICUs. So, there was a little blip yesterday. There was a slight increase in the hospitalizations. All that means is this is something that you keep an eye on, you follow over time. But in general, if you look at how we're doing today and yesterday and the day before versus 1 week, 2 weeks, 3 weeks, 4 weeks ago, we're in a much, much, much better place. I mean, we had north of 4,000 people in hospitals with COVID-related illnesses in Ontario, and now we're hovering around 1,000. We are clearly in a much better spot. So, obviously keep an eye on it, but in general, we're doing a lot better.
Okay, so we shouldn't really be paying too much attention or reading too much into the daily fluctuations. Like if one day it's slightly up, the next day it's, slightly down and then back up again. Is that what you're saying?
Yeah, correct.
Okay.
And just like with the case counts that we had before when we were doing widespread testing in the community, some people would hang off the daily case count and that daily number, but in actuality, most people would take a step back and look at the bigger picture trends, like the weekly trends and the 7-day average and how that changed with time. This is no different. I mean, there's going to be some daily fluctuations in the hospitalizations, but of course the trend is markedly in that direction. Fantastic news. But again, there's a little blip. Let's see how this goes over the next few days. And we'll take it from there. But 1 day's worth of data doesn't really mean much.
Okay, thanks for that clarification. Dr. Bogoch, the Registered Nurses Association of Ontario, they're releasing to the province what they want to see ahead of this election. In terms of what they're calling a staffing crisis, what are you seeing? We know that in the United States, they're having a serious nursing crisis, calling it even worse than COVID itself there. So what are you seeing on our front? Yeah.
I mean, so full disclosure, I will never pretend to speak on behalf of my hospital or the province or Canada or the medical profession at large. But, in general, if you do chat with healthcare providers, you will have, I think you'll hear the same story time and time again, where a lot of people have left the profession. The last 2 years, of course, have been extraordinarily challenging working in healthcare. Just high stress scenarios, huge workloads, a lot of uncertainty as well. Even remember back to the first couple of waves where we weren't sure exactly what we were dealing with. Many of us saw some very tragic cases and some, terrible deaths. And I think, it's pretty clear that many people, due to the work, due to the stress, due to how things unfolded over the first couple of waves, I think many people have chosen to leave the profession. And of course, it's not just doctors and nurses, but there's a very diverse group of healthcare workers, physiotherapists, occupational therapists, speech language pathologists, pharmacists, you name it. There's tons of healthcare providers out there. So there has been significant numbers of people that have chosen to leave the profession. And of course, it's been very challenging, especially with this wave, caring for a large number of people with fewer staff available. If you were to walk through any emergency department, any ICU, any general medical ward, you will hear the same story time and time again, where they're having staffing issues. They're trying to call in people from outside. They're trying to get people to work extra shifts to just help care for the same patients that are there. So this sentiment is being expressed all widespread across Canada and probably in much of the world. This is a major issue. This is a major issue, and I hope there are steps taken to lure people back, to encourage people to go into the field. And, I think, I'm biased completely, but it's a field. It's a wonderful place to work. And I hope people do go back.
Okay, Dr. Bogoch, that does it for my topics. Let's hand things over to Nick now. We have some viewer questions. Thank you.
Jennifer, thanks so much. And Dr. Bogoch, some really interesting viewer questions, really topical, top of mind stuff. Let's get to them right now. Joe asking, my friend had COVID symptoms and tried a rapid test in the nose and it came back negative. Then I advised to try mouth, throat, and nose, and it came back positive. So he's asking, is this the way to go with the Omicron variant?
Yeah. We've heard this time and time again. There's some data demonstrating that sometimes the throat, the saliva will come back positive a little bit before the nose. But there has been some data as well saying that, the swab of the nose is still good and it still works. I would encourage people, if they do have symptoms, to do the test properly and to test the nose and see if that works. And obviously, if you still have symptoms that are compatible with it, you could retest the nose. But also, if you have tests we know tests are increasingly available, you can try a mouth swab or a throat swab as well, and see if that turns positive as well. If there's any positive test, you should treat it as positive, especially if you have compatible symptoms.
Okay. Next question comes from Colleen. She's wondering, her mom's 92 years old, lives in a nursing home facility. She had signed up for the second booster, which was being offered at the home. But Colleen says, much to my dismay, when she came to getting the shot, she decided against it. So the question, how important going forward is that second booster shot? Clearly, this is for an elderly person.
Right. Yeah. So for starters, that second booster shot or the fourth dose is really only being offered to a very, very limited group of individuals in Ontario. It's those who live in a long-term care facility or people with underlying medical conditions where they just won't mount the same degree of an immune response to 3 doses. In all fairness, it's not entirely clear for that population how helpful that fourth dose is. It probably will provide some degree of benefit. It probably will, but it's not exactly clear to what extent. It's interesting because that's a slightly different question than will we all need a dose at some point in the future, perhaps in, I'm making it up, September or something like that, before we see another surge in cases. That's a completely different question than does this person need a fourth dose right now or as Omicron starts to settle down. So the answer is it might help a little bit. It's still being studied carefully. It is being offered because the benefits of this very likely outweigh the risk. To what extent that they do, it's not entirely clear.
Okay, Sherry's got an interesting question. There seems to be a debate around many dinner tables. She says, my adult children have been returning to work in offices, taking public transit and dining in restaurants and bars. Is it safe for them to visit my home without any period quarantine between when they do these activities and then come here?
Right. Yeah. Sherry's got a good point as well. Right. Listen, things are opening up. People are going into the office. People are on taking public transportation to go to work. People are going out to restaurants and bars. Yeah. Obviously, it's wonderful to see some of these measures lift as the burden of Omicron has receded. Fantastic. But of course, there's nothing that's risk-free, right? There's no risk-free scenario. The more people you're in touch with, the greater the probability that you can get in contact with COVID. But of course, as it recedes, the less likely someone's going to come in contact with this because there's just less of it in the community. Again, there's no cookie cutter answer to something like this. I mean, everyone's going to have to make an individual risk assessment at this point as these measures are being lifted. But yeah, I mean, the risk of getting COVID, going to work, taking, the public transportation, going out to restaurants and bars is higher in someone who, for example, stays at home all day. So that's obvious. But, to what extent, I don't know. I mean, it depends on where they are and what exactly they're doing. And again, this virus isn't going to go away. Let's remember that. And that should factor into all of our decision-making algorithms because this virus is not going away. It's going to be here for a while. We're going to see some peaks and valleys. It looks like we're headed into a valley, and this is going to be a period where there's less overall risk. Take that as you will, but sadly, this virus isn't going away. You can get vaccinated, you can wear masks, you can do things to protect yourself from getting this infection, but you're not going to eliminate that risk of infection, unfortunately.
Yeah, we've heard you say that before, Dr. Bogoch. Appreciate you reiterating that this morning. Easy for me to say. Anyway, that is our time for now. Have a great day. We'll chat on Friday. Take care.